Good morning, everyone. Before I start my talk, I would like also to take the opportunity to thank you all for being present today. Since I was in the organization of this seminar, it's really good to see the room filled with so many students from here and other university, colleagues from other universities and researchers, and also so many healthcare professionals and exercise professionals that try to work every day to put in practice the research that we conduct here and in other research centers in Portugal and abroad. I'll start my talk because I will not have enough time. I'm going to focus on the self-regulation processes that are associated with goal pursuit. This is not going to be such a theoretical talk, and I will try to give examples of how we target self-regulation processes during goal pursuit using a randomized controlled trial that I conducted as part of my PhD, and I will discuss some of the limitations that we have on current research and that we believe that it is important to pursue in the future. Just to give a brief, I think I'm doing something wrong. Okay. No? Yeah. Just to give a brief perspective of what we mean when we talk about self-regulation, and as Robert West said in the first presentation, we adopt a very broad definition of self-regulation. The entire idea of self-regulation starts from our personal values, from what we value and what we think it is important to regulate in our own behaviors. So one of the things, and even when we talk about self-control, it is very common for people to think that we are talking about external goals, or we are talking about what other people think that we should do. But the whole idea of self-regulation is that it starts from us, from what we think it is important. Otherwise, we wouldn't be talking about self-regulation, but we'll be talking about compliance or other comments that are used in the healthcare domain. If you look at a very broad definition, we'll see that self-regulation are all the efforts that we use daily to try to achieve our higher order goals, and we'll talk briefly what this means, these higher order goals. So we can say self-regulation for so many processes that it's very difficult to try to focus on what processes are actually important to us. And research is still at the beginning of looking at these processes, and probably we will not identify a cluster of processes that are useful or that are important for all health behaviors, but we will see that these processes can be useful for different health behaviors and for different phases on our health behavior and self-regulation process. One of the reasons why self-regulation is becoming more increasingly popular has to do with the fact that research has consistently identified that there is a gap between our intentions to start health behaviors or to give up on risky behaviors and the actions that we use and the goals that we set to actually starting to do that. For example, I can set an intention to start to do physical exercise in the upcoming month, but there is a gap between this intention and actually going to the gym and starting doing physical exercise. And one of the things that we realize is that self-regulation processes, and especially focusing on self-regulation skills, can help to fill this gap between intention and behavior in itself. So we can distinguish between two main components. One that is related with the goal setting in a general sense, so the desires, the goals that we want to achieve, and the other has to do with the self-regulation processes that we put in action in order to strive and to be able to pursue and attain these goals, or in some cases to give up on these goals. There are many self-regulation perspectives, and the idea here is not to give you a list of all the theories that look at self-regulation, but the idea is to look at how self-regulation processes have been defined, have been operationalized based on the cybernetic and the control theories of self-regulation. So these are classical theories of looking at self-regulation that have started to be applied in a health behavior domain, and there are some processes that might be interesting and important for us to apply in our daily interventions, and this is where I'm going to focus. One of the main tenets of the self-regulation frameworks is that the goals that we formulate, that we commit to, and that we actually try to enact and to put actions to achieve those goals are based on the discrepancy that we detect between our current behavior and the reference value. This means the discrepancy that we detect between, for example, doing or not doing physical exercise and a reference value that for us might be really important of being fit. And for being fit, I need to do physical exercise or engage in other health-related behaviors. Once I detect that there is a discrepancy between my current behavior and this reference value, and the reference value can be very abstract or very concrete, and I will come to this later, once I detect this discrepancy, I will naturally move towards reducing this discrepancy if the reference goal is positive, or enlarge this discrepancy if the reference value is a negative one, so if I want to avoid something. And we are going to focus on approach goals, so reference values that we want to achieve, that we desire to achieve. Once we have this discrepancy, then we can start to engage in health behavior change in order to reduce this discrepancy. But how do we know that there's a difference between our current behavior and our reference values? We need to use the comparators. So we need to use self-monitoring and other techniques that will allow us to understand if we are actually acting in accordance or not to our reference value. I will give examples of this later. And once we have this information and we think that in order to attain these goals, I'll come again to the being fit. I need to do physical exercise, and I haven't done any physical exercise in a long time. Then I can set a specific goal that will serve as a self-reference point. So I'll have a benchmark, and my goal is to do physical exercise. And I can be as specific as indicate the number of days, the duration, what types of physical activities, or just have a goal that it is to do and start doing physical exercise as much as possible whenever I can. And once I have this benchmark of this self-reference point, then I can start to put in practice the actions that are necessary to be physically active and being fit, as it is my reference value, and I will be able to self-monitor. And having this goal, I can self-monitor if I'm doing physical exercise or not, and this will provide me feedback to know my progress towards the goal. If I don't have a goal, and if I don't have a reference value, then it will be really difficult for me to be able to understand if I am progressing to where I want to go, and to have the necessary feedback to see if this is congruent with the goals that I have set at the beginning. So this is called the feedback loop. And this is a cycle in which I have the reference value, I compare, I engage in certain activities towards a goal that will allow me to achieve that reference value. And then along the way, while I'm making this change, my own perception of my behavior and the reference value will change, and this will allow the cycle to continue, because I will now have a different perception of how much physically active I am and what is necessary for being fit, and other reference values will appear along the way while I'm doing physical exercise. And you can apply this to any other health behaviors. The other aspect and the other component is these feedback loops and this perspective of self-regulating our own behaviors only makes sense in the context of multiple goals. And when we consider that the degree to which we can achieve these lower order goals, such as doing physical activity, will facilitate higher order goals that are important for us. You heard in the first session what is our identities and aspects that are related to our identities. And here, when we look at goals, we can also see that there are higher order goals that have to do with ourselves, our ideal selves, or other selves that we want to avoid, the so-called fearer selves. But we are going to focus on these ones. And we have an hierarchical system for more abstract and higher goals to the more specific, concrete goals that can be what we call the motor control goals. So we can go from being happy, being cared, being fulfilled in my life, to being fit, being healthy, being present for others, and then to being able to work, do physical exercise, eating better, and then we can go to these goals of to eat healthy, I need to prepare meals, and to prepare meals, I need to do a certain number of actions. So the idea here is that these goals will facilitate the achievement of higher order goals. And when we have conflicts between these levels, it will be very difficult to engage in self-regulation efforts and health behavior change. So the importance of this hierarchy is mainly the facilitation or the conflicts that occur between goals. And this conflict, this degree of coherence or congruence that exists can be vertically, as I mentioned, but can also be horizontally. We can have goals that are in conflict or facilitate each other at the same level. Again, the example of physical activity. I can value doing physical activity, but I can also value spending time daily with my children or with my husband. And if I find that both of these goals that I value, and this is really important in this perspective, these must be goals that I value and I really want to achieve. And if I consider that both of these goals are demanding efforts, time, resources, money, any other demands that you can think of, and if I believe that they are competing for the same demands, it will be very difficult for me to pursue all of these goals. So I will choose the goal that I value the most, which in this case can be spending time with my family instead of doing physical activity. So one of the things that we want to achieve in interventions is to promote intergoal facilitation and reduce intergoal conflict. So try that the activities and the healthy activities that people should be involved in will facilitate other goals that are at the same level. At the same time, there can also be incompatibilities between these goals. I can have a goal of being healthy, and I want to have a healthy diet to achieve that, and at the same time, I want to be polite. It's important for me to be polite, and I'm at a birthday party, and I'm offered a slice of cake, and I want to avoid eating that cake because I want to be healthy, but I don't want to say no because I don't consider that is polite. This is a common situation in which I'm in a conflict between choosing two values or goals that are important for me in a very specific situation in which I wouldn't even consider that I am facing a conflict between goals and that I have to take a decision in that moment. So the idea is that the more we have a coherence or a congruence between goals at different levels, the more we will be able to promote effective self-regulation and engaging in health behavior change. So how can we target the self-regulation processes? There are many techniques that can be used, and I'm going to focus on a specific trial that we conducted in which we used motivational interviewing and self-regulation skills training to target these self-regulation processes. So we conducted an intervention to promote physical activity with patients with chronic fatigue syndrome. It was a randomized controlled trial. And patients in the intervention group received motivational interviewing sessions and self-regulation skills training through the use of a manual and telephone counseling sessions. Coming to the idea that for effective self-regulation, we need to have both components of coherence and goal structure that facilitates health behavior change, and we also need to have the feedback loops operating at the same time. The first thing in this intervention was to work on the goal structure and to look at the goal structure dynamics. So the main thing here is if we want to increase health behaviors, in this case physical activity, and if we know that increasing the relevance of goals that are at a lower order will increase the probability of engaging in these behaviors so that I can achieve other goals that are important to me or values, one of the things that we do, and motivational interviewing is also really good to work on this, is to increase the personal relevance of health goals. So I need to make health goals as much as important for the person so that this person wants to achieve those health goals. So in this case of patients that have chronic fatigue syndrome, in which being physically active is highly important for chronic fatigue management, one of the things is to make a connection of how being physically active could fulfill other important life goals, such as recovering from chronic fatigue syndrome. Or we can even go to her other higher order goals, such as being present for the family or feeling healthy or being happy, if you want to look at these goals. So making this link between changing my current behavior and being physically active, so a lower order goal, with this higher perception of attaining what we actually value. It can be very powerful, and it's used in motivational interviewing and in other clinical and health psychology interventions to try to make this connection. At the same time, we need to understand what other daily valued goals are in conflict. Doing physical activity can also be in conflict with another goal that is really important in chronic fatigue management, such as rest. So if we don't make a connection between physical activity and rest, if we don't acknowledge that rest is highly valued for these patients, then we have a situation in which patients will not even engage in physical activity or will very rapidly relapse because they also want to rest and they have no idea of how to do both things. Once we have this goal structure addressed, we elicit discrepancy. And in discrepancy, to elicit this discrepancy and to work on this, we also make a link between the current behavior and higher goals, but in a different direction. So here we look at how not being physically active or not being adequately physically active can have an impact on these higher order goals. So the fact that I am sedentary, or that I rest too much, or that I don't do enough physical activity will have an impact of recovering from chronic fatigue. And chronic fatigue is the reference value that these patients usually and tell us that is important for them. So here we make this discrepancy between current behavior and what patients want to achieve, and give them the tools for self-monitor this discrepancy at the beginning, so that they can be sure that they reference value and that their current behavior is actually correct. Because sometimes we also have this perception that currently we are not physically active. And then when we start looking at our daily activities, we'll find out that we are more active than we thought we were, or the opposite. So using self-monitoring from the beginning will also help to have an adequate baseline level of the current behavior and the reference value, so that the goal setting can start from an adjusted starting point. Once we have this defined, then we can go to use the common self-regulation strategies of goal setting and planning techniques that will allow participants and patients in this case to go from having intentions of doing physical exercise to actually being able to implement these intentions. And so we have the common goal setting and action planning techniques that can be very detailed on when, how, where, with whom individuals are going to do physical activity. But one of the key aspects here is that, considering that the goals have to be personal relevant, the goal setting is derived from the individual in itself. So it's the individual that will decide which goal to pursue based on information that they have access to of what it is important and recommended in relation to physical activity in this case. But it has to come from the person. Another important issue is that this goal setting has steps or has small goals that are defined that will allow participants along the way to see how they are increasing in different steps of the goals that they have set. And this will provide regularly feedback regarding their own process. Once the goal is established, then the feedback loop will start with the self-monitoring of behavior regularly and progress related with this self-monitoring. So along the way, I'll see how am I doing with regard to physical activity, and using pedometers, daily records, going to the gym and having register what I did at the gym will give me this support, as well as the contact, in this case with a healthcare professional, would give me the feedback to know where I was going regarding my goal, towards my goal, and if I need to do any adjustments, if I need to abandon my goal and re-engage in other goals, I need to have this feedback. In fact, when you look at the self-regulation perspectives, it is common in every self-regulation perspective that feedback is a main feature to have a successful self-regulation. One of the things here, as I said before, is that once we change and we start to change our behavior, not only our perception of current behavior will change, but also our perception of the reference values. And this is very important. It is very common in case of chronic fatigue patients and in many chronic diseases for patients to have their reference values as maintaining things as they are. So my reference value is not to do anything because I will get worse once I start to do things. And once they set these goals and they start to increase physical activity in a way that it is adjusted, they will have the perception and will understand that physical activity is beneficial and not harmful. So the reference value that they have, that is a -1 to maintain things as they are, will move to more positive reference values, such as increasing physical activity, changing my healthy diet, or do other changes that are important to manage my own disease. So this is one of the goals, is also to change this reference value. How did we assess this in the context of this intervention? We assessed the use of self-regulation skills regarding the goal that was set by the individuals. So to achieve this goal, which kind of skills were used, and you have here the main self-regulation skills that were assessed. And we did find that the use of these skills that come from a self-regulation framework, the goal setting, the planning, the feedback, the goal attention, and goal revision, actually mediated the effects of our intervention, the positive effects of our intervention on goal achievement at post-treatment, and even in outcomes related with fatigue syndrome at follow-up. And similar studies were found by colleagues in the University of Leiden that were also working using the same self-regulation models for other chronic diseases and also in related to physical activity. If we look at meta-analysis and systematic reviews that look at these self-regulation aspects, one of the meta-analysis that was conducted by Susan Mickey and colleagues, looking at the behavior change techniques that are used in interventions changing diet and physical activity, they found that the techniques that combine self-monitoring, which is one of the key aspects of self-regulation processes, with other techniques that derive from this perspective would have more beneficial effects than interventions that did not use self-monitoring or a combination with these other techniques, which reinforces these results. And you can see these effects in other reviews and in other projects, such as the project that we conducted here at the university, looking at consistent mediators of medium and long-term weight change in obesity interventions. So the implications of this is that using a combination of self-regulation processes that derive from frameworks that are established can have more effects on goal pursuit and goal attainment, and goal pursuit and attainment is a key process for health behavior change. And at the same time, this behavior change must be considered in the context of multiple goals and personal values. And when we look at the context of multiple goals and personal values, this is where our limitations are most salient. In the studies that we conducted and in other systematic reviews, this aspect of goal conflict, goal facilitation was not assessed. And one of the reasons why this is not assessed in many studies has to do with the fact that many interventions that are conducted by healthcare professionals in this field assume from the beginning that participants or patients make this relation with other goals and that we need to focus on specific goals that we are working on. And while we address this aspect in the techniques that we use, this is not considered as a key aspect to be analyzed or to be studied. We are focusing on the self-regulation skills that we use, and we are not focusing on the structure and how these things are done from the beginning. So you see that these are some examples, but actually are most of the studies that exist looking at these aspects. And if you look at perceptions of goal facilitation and goal conflict, there are some studies that make an association with physical activity, but most of these studies are not within interventions, are not prospective studies, and assess goal conflict and goal facilitation in various forms, which limits the conclusions that we can draw from this. And when we look at the interactions between different levels of hierarchies, we don't find almost any studies on this. And even in motivational interviewing, in which these techniques are very important, they are not assessed if looking at this goal alignment and other techniques related to goals actually makes a difference comparing to others. And this means that we need to look at multiple goals dynamics and ways that we can assess this correctly and introduce this as a key aspect in interventions to see if they actually make a difference. Does it make a difference to look at the goal structure and multiple goals and these influences when we try to change behavior? And if it does, what are the most effective ways of changing this? And this has been neglected in research, and we also need to understand if this is as important as we consider that it might be. And there are methodologies that can now be useful for us to look at this, such as N-of-1 trials and full factorial designs. And just a final comment, looking at motivational aspects, and you are going to hear more about motivational theories throughout today, but motivational aspects can also be a key process here, as some models associated with self-determination theory, such as the self-concordant model, makes a distinction between goals that we pursued that are fulfilling for us and goals that we pursue for external reasons. And this might make a difference in how we perceive self-regulation processes, and we can effectively engage in self-regulation changes. Thank you.